Hello, I'm Mcculley. I'm a consultant reconstructive and aesthetic surgeon, and I'd like to talk to you about liposuction. This obviously involves the removal of fat from various areas of the body, and this is done by the use of some fine cannulas with some little stab incisions in the skin. In many ways, this is almost the ultimate cosmetic operation that you can create change in the body shape with virtually no scarring. But it does rely on the ability of the skin in that area to shrink back to get the optimal result. It's also important that you remove the fat smoothly to make sure that the skin is left as smooth as possible. Now, liposuction can remove large areas of fat, but really this is more of a reshaping operation than a weight loss operation. And it's important that you understand that if you're trying to lose weight, taking too much fat away can actually be quite dangerous, and also if you take too much fat away, the skin often can't shrink back. So who's a perfect candidate? Well, women and men, but predominantly women to be fair, who have localised fat deposits, classically on the saddlebag or the lower tummy, in men around the breast area. And when you've got these localised fat deposits, particularly if your skin still has good elasticity, then you're likely to see some really good results with liposuction. However, we do at times do liposuction to more global areas, be it the tummy, the flanks and the thighs, and as long as we don't try and get too aggressive, and the maximum fat I would remove is about 4 to 5 litres in one sitting, it is possible to create more total body changes. I do the operation predominantly under a general anaesthetic, so you go to sleep and you would stay in the hospital for one night, or occasionally be done as a day case depending on the size of the liposuction. I've used some pressure garments afterwards, and that's quite important to help support the skin while it's shrinking back in. And the recovery of this is actually quite quick. You would certainly go home the following morning or the same day, and you'd be up and about, but you would feel quite stiff, particularly if it was a very large liposuction. It's a very safe operation if done carefully, although there are some risks, and those risks include small risk of extra bruising, some discomfort, some numbness on the skin, but you can end up with some laxity or irregularity of the skin depending on how your skin started. So if you have quite lax hanging skin to begin with fat, you're going to get even more hanging skin, and therefore actually sometimes some excisional operations like tummy tucks might be better than liposuction, but that would be discussed with you. The recovery will vary depending on the size of the liposuction, anything from a few days even up to a week or so in very large liposuctions. But otherwise this is a routine operation with good outcomes, and whether you come to see myself or a reputable surgeon near you, I wish you the best of luck with your liposuction.